Today we're going to talk about 12 senior superfoods to help reduce swelling in your knees, hips, and ankles. And stick around to the end because there are two bonuses that you're not going to want to miss. And today we're talking all about 12 senior superfoods that are going to help with knee, hip, and ankle swelling. If you're dealing with arthritis, bursitis, tendinitis, or just overall aches and pains, I have no doubt that you're eating foods that are fueling the inflammation. And by swapping out those inflammatory foods for anti-inflammatory foods, you're going to feel so much better. Let's dive right into number 1, vitamin D. Vitamin D is actually a hormone, but when it's lacking in the body, people experience bone pain, joint pain, muscle pain, and they become more prone to falls. In fact, people with low vitamin D levels have 3 times the risk of falling compared to those with sufficient vitamin D levels. Studies show that increasing vitamin D levels can help decrease pain and increase function in people with osteoarthritis. The problem is that most people don't get enough vitamin D. So you can take a supplement if you live in a sunny area, or you can spend time outdoors. Just 10 minutes of sun exposure on your face, arms, and legs a couple times a week should do the trick. Just be sure to use sunscreen after that 10 minutes. Next up, fatty fish. Fatty fish like salmon, mackerel, and tuna are high in omega-3 fatty acids. Omega-3s are great at reducing inflammation in the body. In fact, studies show that people who eat more omega-3s have less arthritis pain. But be careful, because too much of a good thing can actually be a bad thing. You need a balance of omega-3s and omega-6s, and most Americans get way too many omega-6s and not enough omega-3s. I'll link an article below that will help you learn all about this. So omega-3s are good, but omega-6s are bad. Well, not really bad, but you don't want too many of them, as long as you have enough omega-3s. Again, the ratio is important. You want to be careful with fish, though, because some fish can contain high levels of mercury, so it's best to avoid these fish entirely. Orange roughy, shark, swordfish, and tilefish. Number 3 is turmeric. Turmeric is a golden-colored spice that comes from the turmeric plant. It's been used for centuries in India and other countries for its medicinal properties. That's because it contains curcumin. Curcumin is what gives turmeric its anti-inflammatory and antioxidant properties. Curcumin has been shown to help people with osteoarthritis. It can also help with depression and certain types of cancer. Now, turmeric on its own isn't very bioavailable, meaning that your body doesn't absorb it well. But if you add black pepper or a fat like olive oil, then it becomes more bioavailable. So adding a little bit of black pepper or fat to your food can make a big difference. All right, number 4 is pineapple. Juicy fruits like pineapple contain bromelain, which is a powerful anti-inflammatory enzyme. Bromelain has been used to treat arthritis, sinusitis, bronchitis, headaches, sprains, strains, and post-surgical inflammation. One study showed that bromelain was just as effective at reducing knee swelling as ibuprofen. Plus, it has no side effects, so if you're tired of taking medications that have side effects, then give bromelain a try. You can find supplements at most health food stores. Speaking of supplements, number 5 is ginger. Like bromelain, ginger can also be used to reduce nausea, pain, and inflammation. It's often used to help people who are undergoing knee or hip replacement surgery recover faster. Studies show that ginger can reduce pain and inflammation, especially related to osteoarthritis. Now, ginger is safe for most people, but if you're taking blood-thinning medications, then it might not be a good idea to take ginger supplements. Always talk to your doctor first. Number 6 is cayenne pepper. Cayenne pepper is made from the dried fruit of the cayenne pepper plant. It's used to add heat to many dishes, and it's a common ingredient in chili. Cayenne pepper contains capsaicin, which has powerful pain-relieving properties. Capsaicin has been used topically to treat osteoarthritis, nerve pain, shingles, and even pain related to cancer. Now, I wouldn't recommend putting cayenne pepper on your skin, but eating it might be a good idea. Adding cayenne pepper to your food can help reduce inflammation throughout the entire body. All right, number 7 is citrus fruits. Fruits like oranges, grapefruit, and lemons are packed with vitamin C. Vitamin C helps the body produce carnitine, which aids in the breakdown of scar tissue. Scar tissue forms when someone experiences an injury and their body heals. Sometimes that scar tissue can cause restrictions in range of motion. So if you have tight, stiff joints, then eating more citrus fruits may help loosen things up. Citrus fruits are also full of flavonoids, which have been shown to have anti-inflammatory and antioxidant properties. Number 8 is nuts and seeds. Eating nuts and seeds can help reduce knee swelling because they're full of healthy fats and fiber. Healthy fats help your body absorb vitamins that are necessary for reducing inflammation. Fiber helps your body eliminate toxins. Unfortunately, most Americans aren't getting enough fiber. So step up your fiber game with nuts and seeds. Some of my favorites are almonds, walnuts, chia seeds, and flax seeds. All right, number 9 is dark chocolate. Dark chocolate is one of my favorites. It's high in flavonols, which are powerful antioxidants. Flavonols can help improve circulation and lower blood pressure. In fact, dark chocolate can reduce inflammation and help prevent blood clots. Now, when it comes to chocolate, you definitely want to choose wisely. You want to have at least 70% cocoa or higher. Otherwise, you'll be consuming too much sugar. All right, number 10 is green tea. Drinking green tea can help reduce knee swelling because it contains polyphenols. Polyphenols help reduce inflammation and oxidation in the body. Studies show that people who drink green tea regularly have less knee pain and better physical function. Number 11 is oats. Oats are full of a type of fiber called beta-glucan. Beta-glucan helps reduce cholesterol levels, and when your cholesterol levels are high, it can lead to heart disease and diabetes, and both of these conditions can cause joint pain. So by eating oats, you can help reduce your risk of developing conditions that can cause joint pain. Oats are also full of magnesium, which helps regulate blood sugar and relax muscles. This is why athletes often consume magnesium supplements. Last but not least, number 12 is bone broth. Bone broth is rich in collagen, which is a protein that our joints need. When we age, we lose collagen. This is one of the reasons that we develop osteoarthritis. That's because our joints begin to break down. So by eating bone broth, you can help replenish the collagen that your body needs. Bone broth is also full of glucosamine and chondroitin, which are natural substances that our bodies make and help lubricate our joints. Our bodies make these substances, but when we lose collagen, we also lose these substances. So it's a good idea to get them from outside sources as well. Now you're probably wondering what the 2 bonuses are. The first bonus is that you can download my checklist, which will help you determine if you have a labral tear in your hip or your shoulder. There are several different tests that you can perform to determine if you have a labral tear, and I go through each of them step by step in the checklist. With the second bonus, you'll receive my newsletter. In the newsletter, I share weekly tips and resources that you won't find here on YouTube. Thanks for watching. Be sure to like, comment, and subscribe. And as always, I hope you remember that pain sucks. Life shouldn't.